This is BBC World News. I'm Sally Bundock. The World Health Organization says there's evidence that COVID-19 may be spread by tiny particles suspended in the air. We begin with the World Health Organization. It's acknowledged there is emerging evidence which suggests COVID-19 is being spread through tiny particles breathed out by infected people. They say it's passed on when someone exhales micro droplets that are so small they remain suspended in the air, which others breathe in and potentially become infected. If confirmed, it could change the way we have to behave to protect ourselves against the virus. The WHO's Infection and Prevention Department has updated its position.
We acknowledge that there is emerging evidence in this field, as in all other fields, regarding the COVID-19 virus and pandemic. And therefore, we believe that we have to be open to this evidence and understand its implications regarding the modes of transmission and also regarding the precautions that need to be taken.
The WHO was responding to an open letter signed by more than 200 scientists calling for the medical community to take the risk of airborne transmission more seriously. They say micro droplets can put people at risk of exposure, even if they are more than 1 to 2 metres away from an infected person. The lead author of the letter, Professor Lydia Mororska, told me the evidence needs to be used to better curb the spread of the disease.
Well, this is an evidence not coming just collected just during this pandemic or just recently. We've known, the scientists, we've known for a long time that aerosols from human expiration, when we breathe, when we talk, when we speak, are in the air and can be inhaled by others and cause infections. So in a way, this is nothing new. It is, however, extremely important that this was accepted, that this was acknowledged, because now we can move on and we can control this to minimize the infections.
Well, let's discuss this further with Paul Hunter, Professor of Medicine at the University of East Anglia. Welcome to the programme. Where are you in this great debate about air transmission?
I think I'm sort of halfway in the middle, really. I've always believed that there will be some transmission associated with aerosols, but that does not mean that I believe that they're an important transmission pathway. I think the evidence is quite certainly leads towards aerosols not playing a significant role in the transmission of the disease. And this is important for a number of reasons. One is when you're trying to control a disease like COVID-19, what you're trying to do primarily is interrupt the main transmission pathways. And the focus has to be on that. And the evidence that if we move to try and block all aerosol transmission, that's actually substantially more difficult. It's substantially more costly, and actually it probably doesn't make that much difference. I've read this letter, and it's largely written by people who are chemists and people who don't work with infectious disease and don't really understand all the intricacies of disease transmission. And if we move away from the main focus, all we will do is confuse the public, will confuse policymakers about where they should be directing their attention. And that has to be, and that remains primarily around droplet transmission. And I think it's a shame that this letter came out as it did when the WHO is under attack from particularly from the US president, and to try and whether or not that was the intention of the authors, this letter will certainly add to damage to WHO at a time when really we've got to be pursuing the primary role of controlling this virus.
Obviously, right now we're talking about COVID-19, but there is discussion that there would be the possibility of another pandemic in the future and, in years to come. This is going to be something we're dealing with more than not. Therefore, do you think the looking into investing in better ventilation in buildings, that kind of thing, which prevents air transmission, would be a good long-term idea anyway.
Well, I think it depends on the nature of the building, clearly. But if you're in high office blocks with very little natural ventilation, yes, you've got to have good artificial ventilation. And there is some evidence that controlling the air quality in those buildings has an impact on people's health. But that doesn't mean to say that actually that will by itself control COVID-19, because I don't think it will. I think we've seen quite clearly that droplet precautions, when implemented around the world, have been very effective at controlling COVID-19. And to distract from that at the moment, I think does the world a disservice, and actually potentially by the confusion might actually make matters worse if it leads to people maybe disobeying and diminishing droplet precautions, and but perhaps believing that if they've done other things that they don't need to worry about droplet precautions.
Okay, Professor Paul Hunter, thank you for your time. We appreciate getting your perspective on this story, and of course just to say that there is so much more detail on that open letter from the various scientists and what others are saying about this on our website, so do take a look if you wish to dig a little deeper.